Dr. Yasir Javed, cut to the chase. I would like to ask you one of the my first important question of the day and of the podcast. Being here, attending the conferences based on cardiovascular diseases and diabetes, what kind of a difference have you seen in the health system of Pakistan and British?
I think there are two very distinct healthcare systems. In England, we have the National Health Service, where it's essentially free at the point of care. So it doesn't matter where you live in the country, what your income is, everyone gets the same basic standard of care that's free at the point of care. Whereas in Pakistan, I think it's a little bit more disjointed and perhaps affordability may come into the equation in terms of what quality of care you may receive.
So here you're using the term quality. So we agree to the point that there is something lack of quality in Pakistan's health system as well, which is coming even from ages, and we cannot. We are just making sure that we could, bring some improvement to the health system in other years in future. But surely there is something which is keeping us as a glitch, and there is a glitch in the system. But sir, Dr. Yasir Javed, just tell us why there are so many heart conditions and heart diseases brimming up. And why there is a rate and ratio increasing day by day in young generation, young lot?
Yeah, I mean, this is a common phenomenon actually across the world. We know that, firstly, cardiovascular disease, which is essentially a combination of having a heart attack or a stroke, is on the increase. It's the world's biggest global killer. So it's not just a problem in Pakistan. But we do know that a Pakistani population may have specific genetics that may actually enhance that risk. And one of the biggest risk factors also is type 2 diabetes. Type 2 diabetes is, I would say, like pouring petrol on the fire of cardiovascular
Acts as a
disease.
catalyst?
It's a huge catalyst. Not only do patients with type 2 diabetes get heart attacks much earlier, but their heart attacks are actually more devastating. They can be more dangerous, yeah.
And not easily could be managed or handled.
But type 2 diabetes is a global pandemic. It's not, it's on the increase throughout the world, driven by sedentary lifestyles, visceral obesity. By visceral obesity, I mean obesity around the belly. That's the dangerous type of fat that accelerates this whole process.
All right, and it accelerates. There is one major factor. You're talking about genetics and then diabetes. But what if there's a person who has no such history of genetics, heart attack and genetics, and also diabetes, but he or she faces heart attack? Then how can we say and how can we evaluate that what's the root cause?
So, yeah, genetics play a role, whether you get type 2 diabetes, but there are a whole host of other risk factors. Being male is a risk factor. Men get heart attacks much earlier than women in younger age groups. Ethnicity. So I come from England, and certainly we know patients of South Asian ethnicity are at much higher risk. Bangladesh, Pakistan, India, ethnicity, these definitely accelerate your cause. We don't know. I mean, it's multi-genetic factorial, but a lot of it could be due to, again, your predisposition to putting on fat around your belly and your risk of getting type 2 diabetes.
You talk about belly. So by belly, you mean that your gut system and your gut, the whole system of your gut has to be kept in a well-managed formation. It means that it is also related to your food, to your diet, to your habits and every other thing. Because if you keep your gut strong and healthy, it definitely decreases the risk to have heart diseases at earlier age, and even not at an earlier age, but also later on. Is that true?
That is absolutely true. So lifestyle plays a big role. So most conditions in medicine are an interplay between genetics and lifestyle. So you've got to have the genetic predisposition that loads the gun, and the lifestyle pulls the trigger. So you've got to have both. And by poor lifestyle, it's not just diet, it's lack of exercise, sedentary lifestyle. But in terms of the diet, particularly in South Asians, they tend to have diets that are very rich in refined carbohydrates. And really, it's the carbohydrates that probably do most of the damage in terms of this abdominal fat accumulation. So it's the bread, rice, potato, sugar, pasta. If you eat these in excess, which is quite common in an Asian diet, it does get accumulated as this dangerous, very dangerous visceral fat, we call it. And that's what can really accelerate you're furring up of your arteries.
And you never know you get a heart attack. You
A lot of
never know you get heart attack, right?
A lot of patients get no warning. They're blissfully unaware that their arteries are being furred up until one fine day, one of the blockages in their arteries can just rupture. And when that blockage ruptures, it can form a blood clot immediately. And that can block an artery to the heart, and you can get an immediate heart attack.
Right.
Without any warning.
So how can we cope up with such situation? Or let's just get to the lifestyle first. That how to keep a lifestyle healthy where you can avoid such diseases.
I mean, it's not rocket science, but we need to make sure that patients are being very active. Exercise. There's no drug treatment that can replace the virtues of healthy living.
All right.
You know, no drug that you can get from your doctor can replace those benefits. So being as active as possible, preferably also incorporating some high intensity exercise, as well as resistance training, we know is very good for cardiometabolic health, we call it. Smoking cessation is absolutely key. We know that cigarette smoke contains lots and lots of chemicals that speed up the furring up of your arteries. We've talked about healthy diet. Portion control as well. I think South Asians, in my experience, I can even speak for myself, I'm of South Asian ethnicity, we do tend to overeat. Portion control maybe could be improved.
At times, yeah.
At times. So those would be the main things. And maintaining a normal weight.
Healthy lifestyle. Living a simple life.
Simple life, eat in moderation.
Not so fancy foods every other day.
Yeah, everything in moderation and try and burn it off with exercise.
True. So doctor, suggest us, if someone is in depression or stress, can that depression or stress lead to heart attack?
That's a really good question. We know that patients who have a history of depression and stress are at increased risk, but we don't know whether it's the depression or stress or the fact that people who are depressed and stressed tend to have
both are
poor lifestyles.
Yes.
And they don't perhaps exercise as much. Perhaps a lot of people who are stressed smoke too much, drink too much, eat too much. But there are other risk factors that we probably should talk about. Blood pressure, cholesterol, kidney problems, and diabetes. They all play a role in terms of potentially accelerating your risk of having early heart attacks.
So how can you control diabetes?
The best way to control diabetes is to prevent yourself getting it. So the best way to prevent yourself getting diabetes is exactly all the lifestyle measures that we talked about, maintaining a healthy weight and lots of exercise and really reining in those refined carbohydrates. All
right. And for example, sometimes obesity and overweight also leads to heart problems, high blood pressure. And as you said earlier, is that possible? A woman or a man can actually control his or her weight at any stage of life to get rid of these problems. High blood pressure. Can high blood pressure be controlled?
It can. I mean, high blood pressure is very much related to genetics as well, but a lot of it is related to weight, excess weight. So we know that significant weight loss can actually normalize your blood pressure. And it is really important to check your blood pressure because you cannot feel whether your blood pressure is high or not. And you can get machines that are very cost effective. I encourage all of my patients to just buy these machines and just every now and then check their blood pressure at home and make sure that it's not elevated at that sort of dangerous level. Something over 140 systolic blood pressure, you really should be getting that checked out by your doctor.
There are certain queries when we talk about symptoms of heart attack. There's a research which says before you have heart attack, you might go through such symptoms which leads to heart attack. How can you evaluate or how can you pinpoint those symptoms?
Can be difficult, but most patients who have a heart attack generally get some sort of discomfort. I won't necessarily call it pain. It's often a tightness. It's not something sharp that
shortness of breath.
You can get short of breath, but it's usually a tightness, a heaviness. Some patients will describe it as if someone's sitting on their chest, and it's usually
squeezing
diffuse.
It or
squeezing is a good terminology sometimes patients use, but it's not like a knife going in. If someone says I've got a very sharp pain and they can point to it, unlikely to be cardiac pain. This is a diffuse pain, and it can go down the left arm. It can radiate to the jaws as well. But the key thing is patients generally feel unwell. They're often sweaty, clammy, feel a bit nauseous. Any symptoms like that.
Panting, walking upstairs, downstairs, or having a neck pain, maybe? Could
Yeah,
be.
it can radiate to the neck, both sides of the neck as well. So it's different location in different patients, but it's usually that sort of squeezing nature, and patients will be unwell. You're not going to see a patient with chest pain who looks very well having a heart attack. That's going to be very unlikely. They usually look unwell as well.